Hey, I'm Dr. Jen Esquire, better known as DocJenFit, and today we are going to address the sciatic nerve, so that thing called sciatica. A lot of people experience it. If you're unsure of where it's really coming from, because it could be coming from the back, but there are several things that could be happening in the back that could cause some pain and some reasons why you might need to get into some of these exercises and stretches for the nerve that we're going to do today. But if you have more questions on where it could be truly be coming from and what yours could be, we actually did a podcast on this on the Optimal Body podcast. So go ahead and click the link up here in order to get access to that audio so that you really learn what's happening in the body and you feel more empowered. Now, if you have it, let me know below. Tell me what kind of symptoms you're having, what you experience, and I'm going to show you what you can do for that nerve, because guess what? That nerve gets kind of inflamed, and when it gets inflamed and it has a lot of pain or some symptoms running down that back of the leg, it doesn't move as well through the tissue. And so the point is that we want to get it to move and function a little bit better through the tissue. So that's really what nerve gliding and slides do. So we're going to start with some nerve slides, just to get that nerve kind of gliding in that tissue. It was known as like flossing, because if you think of flossing through the teeth, the floss moves back and forth, right? And we're just trying to create space so that that nerve doesn't have as much inflammation, doesn't get stuck, and hopefully not as painful. However, if you are feeling increased symptoms after any of these, please stop. And I do recommend seeing your local physical therapist in order to get a proper assessment for what you need for your body. Okay, so I'm going to use a little bench here. This is just a little bench that you can use. You can kick your foot up on really anything, okay? It just helps to keep that foot elevated. We don't want to go super high, because then you're going to get a lot of stretch, and especially if you're having any symptoms down the leg, it's not going to feel so good. So make sure it's a really low surface, and then your back foot that you're standing on is directly underneath you, okay? And first thing that we're going to do is actually relax the foot. So you don't want to put a lot of pressure. The moment I bring my toe up, I'm already putting my nerve on stretch, because it comes from the back all the way through the bum, down the leg, and all the way to my toes. So if I'm doing a hamstring stretch and really pulling on my toes, I'm really just pulling on my nerve. So let's relax that foot, and we're just going to go into the first level here. So this is level 1 of your glides. You're going to take these hip bones and you're going to dive them forward. So dive them forward like this. You should feel a hamstring stretch. If you feel a stretch all the way down into your calf, then you're really getting into that nerve already. Okay, if you feel increased symptoms in your back, I want you not to go as far or to stop. Another good thing that you can do is actually just try the opposite side. So even if you're having symptoms down the right leg, start with the left leg, okay? And then you might feel like these nerves down the legs and the butt, they still connect into the same area. So doing it on one side can still have a pull and effect down the other. So if you are feeling symptoms down the leg that has the symptoms, try the other side first and then go back to the leg that has the symptoms. Okay, so you just do about 10 of these. For nerve stretches, we don't want to hold, we just move. Okay, and then the next one, to kind of bump it up for level 2, we're actually going to bring that toe back towards you. So bring that toe back towards you. Now you should really start to feel that nerve kind of tensioning, and it's going to go all the way down to that calf and then the foot. Again, if you're feeling increased symptoms, stop, go back to the other level. If you feel increased back pain, stop and go back to the other level. Okay? So this is just a level 2 of tensioning into that nerve to get it to kind of move and relax through that tissue. Then I'm going to put this guy away, and we're going to lie on your back. Okay, so for this one, we really want to think of, again, basically the same thing, but now the back is going to be supported by the floor. I'm going to take my hands on the back of my thigh. This is a great one you can do first thing in the morning before you get out of bed. And for level 1, I want to point my foot to the ceiling and then relax it and flex. Point and reach, relax and flex. Point and reach and relax. Okay, so this is a great way to just start to wake up the nerve again first thing in the morning, as long as you're not having increased pain and symptoms. Level 2 is now bringing the toe back to your face. So point at the bottom and then bring the toe back. You do not have to extend very high. As soon as you feel it, then you relax it. A nerve, unlike a muscle, we don't want to spend a lot of time in it. Okay, you just want to kind of feel it and then relax it. Feel it and then relax it. Okay, if you want to bump it up even more, you will lift the head and then coming back down. Lift the head and coming down. That is a little bit more extreme, so definitely don't go into that one. All of these are each only going to be about 10 reps each. Listen to your body, do the opposite leg if you need to, and don't start with the affected leg. Again, any nerve symptoms, I like to tell you, go see a doctor of physical therapy. It is well worth it, especially before having any injections or surgery. Do conservative treatment first with your local therapist and see how they can help you relieve that pain. If you like this video, make sure you like it, subscribe so you don't miss any in the future, and comment below to let me know what you're feeling.